Okay. Good morning, world. How are we this morning? Wednesday morning. Wednesday morning here, Australia. Now, this morning, what are we talking about? This doesn't actually have anything to do with like a news article that I've read or something. More of a conversation has been taking place in Australia for the past couple of weeks based on the tragic passing of a young lady who had given birth with multiple people supporting her at home as she had wanted. Who tragically suffered a hemorrhage and wasn't able to be saved after calling an ambulance and going to hospital. Now that has opened up a whole can of worms that I think the government health department in Australia has been frothing for, where they have issue with I think they've had issue for a long time with women who free birth, and now they're trying to basically criminalise anyone who, even like doulas and things who offer their services for free birthing at home and things. It's not like they're just some random off the street. They are people who dedicate their lives to being very knowledgeable about all things to do with pregnancy health, birthing, newborn assessment and health. They are not people who are anti-government and anti-calling an ambulance for help. In Australia, it is legal to go through a pregnancy without medical assistance. It is legal to go through a birth without medical assistance. So like that's the way it is, and yet the medical fields have been like just wanting to shut that down. They've been wanting to shut that down, even though it's a woman's right, even though for a lot of women it brings them a lot of peace and comfort to do that option. A lot of women find it very stressful and traumatic having their babies at hospitals, and I can vouch for that with having terrible experiences through hospitals I've had 4 children already, absolutely some of the stuff traumatic, very traumatic. And it's a very sterile environment, in general. These are strangers that you're having your most, intimate, personal, or, just such a special moment. You've got people in the room coming in and out. So many people looking at clacker. And just because people are in the field of, pregnancy and birth does not mean that they are lovely people. I can tell you that. I have come across plenty of people who have been judgmental, who have, given my partner and I the side eye. People, I remember one midwife who even said to my partner that, the cause of me having preeclampsia, which obviously comes with some pretty serious, associated risks for both the baby and the mother, was his fault because he was a new partner. I was once induced, like started an induction late at night as well, because of me having preeclampsia. And then I was sent home. I was asked if I would mind to actually stop the induction and go home, because there was another lady who was further along in her pregnancy, in her labour, and they didn't have the staff on to handle the second labour that night, the second birth that night. So they could, at a major hospital, they could only handle the one birth because of a shortage of staff. And we lived like an hour or so away from the hospital too. And I had been told as well to go straight to the hospital by my doctor and have an induction because of the high risk situation I was in. Just crazy. And there's other things with different births as well. But anyway, I can tell you now that some of the staff as well are just terrible. And it's very upsetting, it's very off-putting. Even with this bubby coming along, I've had issues with the hospital that I have had to be dealing with, and the midwives, and it's unfortunate, yes. I'm very comfortable with my doctor that I see, but not so much anyone else I've had to deal with in regards to the hospital and the pregnancy. And I can understand 100% why there is sort of a change in recent years where more and more women are looking to have more natural care provided, seeking more natural self-care during pregnancies rather than going through not traditional, like Western doctors and things like that for their pregnancy. Even because, even with COVID, when everything was happening with COVID, they were pushing on women to take the COVID vaccines, even though they had just been created, they had just been rolled out, and we had no way to know what would happen to the pregnant mother or her unborn child. And that was an extremely high risk situation. I cannot believe that was even legal to do, and the guilt that was actually put on women at that time too, basically like telling a woman that, well, if you want your baby to survive, if you don't want your baby to die because you contract COVID, you best be taking these vaccines that we're telling you about. And look, I don't have the actual video reference or the name of the person who spoke about this off the top of my head, but I know that there was a video circulating from in Australia during that time of a lady who worked in a some sort of scientific lab where they sort of assess, this is a touchy subject, but they assess the possible causes of why a baby didn't make it. And and there was a huge influx apparently during that time period. And you know, it doesn't take a rocket scientist to put two and two together, that possibly you know, causation was the vaccines that were being pumped into pregnant women at the time, causing complications in their pregnancy. You know, I mean, that is a very real possibility. And I know that there is, you know, for years there has been a lot of discussion and research in multiple countries in regards to whether or not it's true that there is any causal link between childhood vaccines and autism or any other illnesses in childhood. And you know, even the CDC in America, you know, have recently changed their language they use on their websites to better, you know, more accurately, you know, provide their statement to say that there is no research that proves that there is no causal link between childhood vaccines and autism or other related illnesses, not related, but, you know, other illnesses in childhood or that cause any kind of developmental problems. And so, you know, even that, I had a look. Sorry, I'm just going to fix it. I had a look just to remind myself to be more accurate of how many vaccines are offered during pregnancy and to infants in Australia. And so during pregnancy in Australia, women are offered about 4 different vaccines during pregnancy. One of those is a COVID vaccine. You know, the others are like whooping cough and the flu, and which I'm confused why every year they offer a completely different flu vaccine. But it's like, okay, well, if you've made this vaccine based off of what flu was going around last year, why are you offering a different flu vaccine this year? Like, because it's a different flu vaccine every year. Like, how do you know what flu is going to be around this coming year that you're vaccinating me for now? I get very confused by that, and I'm a bit suspicious about that. You know, like, are you not putting a new variant out there yourselves? Are you not causing variant changes in the flu yourselves and then spreading it through the community? Like, to me, like, I'm not a doctor, I'm not a scientist, but to me that's what that means to me, you know? Anyway, and then, so for infants in Australia, by the time an infant is 6 months old, they are given 26 different vaccines. Yes, some of them are combined in the one needle or in the one oral thing, but it is 26 different things being put in their body by the time they're 6 months old, that their body has to identify and, you know, create an immune response to, has to fight off, basically. You know, in the first 6 months of their life, 26 things that their body has to fight off. And by the time they are 18 months old, so a year and a half, it's 48 diseases and serious things that their body has to have an immune response to, has to fight off. And, you know, I can tell you as well from the experience of already having 4 children, that it's not always a pleasant experience for them either, is it? It's not just oh yes, we'll give them this vaccine and there's going to be absolutely no symptoms and they're going to be totally fine because it's only one little tiny drop of it, you know, blah blah blah. They sometimes like try to make that out to parents. They sometimes try to say, oh yes, you know, there'll be nothing but maybe a little bit of you know, grumpiness and a bit of maybe soreness where the injection site was. BS. Okay, I've had kids with like severe gastro that then gets everyone in the house after having vaccines. My oldest daughter, when I forget how old it was maybe around the 12-month mark. Her response to the vaccines that she had around that age was literally like, it was like she was dying. It was literally like she was dying. I took her to the doctors and everything, so worried because she was so pale. She had rings under her eyes. She had no energy. She wouldn't eat. She wouldn't drink. She was just, it was like she had given up on life. Like, seriously. You know, and then the doctors tell me, oh yes, you know, she's just not feeling very well after having her vaccines and she's fine. You know, and no, there hasn't been, you know, any kind of ongoing serious concerns with her health or development or something. But, I mean, maybe there could have been. Maybe she just came good where other children could have really not come good, you know? Sorry. But that was so scary. That was so extreme. And, you know, yeah, it's not just like, oh, it's just a tiny little dribble and they're going to be totally fine. They're not going to have any kind of serious illness from these vaccines. No, BS. They are always very sick after having these vaccines. They always come down with, you know, cold and flu symptoms and fevers and, you know, sometimes rashes, sometimes, you know, no interest in food and no energy and things like that, you know. And we're putting our infants through that from birth, you know, up until school age, basically. You know, just like pumping them full of diseases and things and they have to fight off. I mean, to me, it doesn't make sense that we're doing that. You know, that we're just like, oh yeah, oh, totally normal to just like shove all these diseases into a brand new sensitive infant's little newborn's body, and just see how they go, you know? Like, and like, do you think that like there are not babies, there are not children who have vaccine injuries? Of course there are. That's why there's a whole thing about it. You know, but it's all shrouded in secrecy, and you know, you could get sued by the government and various different departments if you go public with your story, or if you talk about you know, what happened to your child, or you know, you name names or of like vaccines or of healthcare providers, or you know, whatever. Like, you're risking getting sued, you know. And it's just crazy. It's like, oh, okay, so you guys can just be like basically guilt tripping parents into you know, taking all these vaccines while the woman is pregnant, and then like pumping all these vaccines into your baby. Like, the first one is like given to your baby, I'm pretty sure, like at birth. The Hep B one. You know, it's like, and then if you are a parent who's like pretty concerned about that, and you say to you know, your midwives or your doctors, or you know, the people that are supposed to be respecting you and taking care of you and your baby at the hospital, if you say something to them about, no, I don't I don't want the vaccines, myself while I'm pregnant. And I also, I don't want my baby being given any of these vaccines. They treat you different. They 100%, 1,000% treat you different. They give you the side eye. They try to re-educate you. They send you home with lots and lots of brochures to re-educate you because you clearly are misguided. You clearly have been convinced by the Looney Tunes on the conspiracy channels. They treat you like that. Just the same way that women who are opting to have just more like natural care during pregnancies and free birth and have doulas and all that sort of stuff, they're all being targeted too because, why are women trying to be all natural and do it all that way when they could, have doctors telling them exactly what to do from, day one of the pregnancy to, 5 years old, that your child turns, and we're going to, guilt trip you into this and this and 20 million vaccines pumped into your child. And we're going to, just like, it's all very invasive as well, like even pregnancy care, and I mean, talking about pregnancy care, I mean, I've had even, I've had like, like issues come up with, like cervical issues come up, right? And they required a colposcopy. And I can tell you, like, it's like these people are supposed to be like in this specific field, right? You would just assume that they are like the most caring and sensitive, like empathetic to your situation people. And yet I was put through like just so much, like had to have multiple pap smears with a colposcope still, which was not done gently. Then I had to have multiple cervical screens separate. Then I had to have a colposcopy. And that lady, that doctor, I don't know if it's because she was a woman and I'm a woman and she just assumed that it's all cool. But, she made me undress, waist down, without any privacy in front of her and the lady that she was training. No curtain, no blanket, nothing, no privacy. Yep, get up on the table in front of me. I'm already sitting here, spread your legs, hurry up, you've had this done 15 years before, so I don't need to explain to you what we're doing. And, like a little bit, maybe too much information here, but like was so rough, that I bled even from it. And, this was more than halfway through my pregnancy. And I was left like feeling traumatized by that whole experience. And I was supposed to go back for other procedures, and I cancelled all my appointments because, and I said to my doctor, like, no, I'm not going back to that and to her. And even if it means that things take longer for treatment and things like that, I'm willing to do that. I'm willing to put it off until after my baby is born and I'm healed and I'm ready to put myself through that experience, because that traumatized me, and I don't even think that they should be doing that to pregnant women. They say even online and stuff, there's no risk involved, you know, for pregnant women to have a colposcopy done. But it's like, yeah, maybe if you've got somebody doing it like really like sensitively, like really gently and things like that, not somebody who's like basically like, you know, like ripping you open with a metal freaking tool, you know, just like, my God, like I cannot even. Cannot even, like, so traumatic. And yeah, so not going back to deal with any of that for like quite a while, really. And you know, yeah, even the midwife that I had to deal with there, you know, she's basically, because I have had a free birth before, and she was like questioning me, like, oh, okay. And like, what was it that like made you decide to do that? You know, like with knowing the risks involved and things like that. And you know, just like really like how she like sat her, like positioned herself physically and like sat there, and like it was like I was like in an interrogation room, you know, and having to like defend my life choices. And yeah, and then like talking about how, you know, oh well, you know, in Victoria we have a, you know, issue with a lack of, you know, Ambulance Australia staff and the response times of ambulance and all this sort of thing. And you know, if there was an emergency, you're not even guaranteed that someone's going to be there for like, you know, it could be hours, you know, and on all this sort of stuff. You know, like basically putting fear in me to like never make that decision again. You know, making me feel like I was an idiot, like I was just so stupid for ever having done that. And yeah, and like telling me like, oh, go tell your friends, you know, like basically like re-educate your friends about the risks involved with free birthing. And then so it was like after that the story, that I heard the story about the lady who passed after giving birth to her son in the last month or two, I think it was. And you know, of course it's sad, but you know, that same thing could have happened in hospital. It could have, you know, especially when you talk about like there are constantly staff shortages in hospitals, and she could have bled out in hospital. There are complications that happen in hospital too. There are situations where the midwives and the doctor, you know, basically force a woman into giving birth naturally, even though things aren't happening naturally. And I've been in that situation as well before. I ended up going through a labour once that, like me being in the labour room for 22 hours. And I had one younger midwife suggesting to the older midwife that I needed to get prepped for theatre, to have a C-section. And the older midwife denied that and said, no, she's young, she can do it. And I ended up going through a 22-hour labour. So traumatic. Like by the end of it, I was like, I was like screaming for them to like cut the baby out of me. And I was just like vomiting everywhere from pain and exhaustion, and I didn't want anything to do with it. I was like basically disassociating from the whole situation, like to protect myself mentally or something. You know, and that's what I mean. Like, you know, there are so many stories as well of injuries to newborn babies from using the forceps, from using the vacuum, you know, just, yeah, from making a lady like push too long, like too much, and it being stuck and all that sort of stuff, you know. And yet here they are basically just like creating a war on women who want to do things more naturally, do things that feel more natural and, you know, better for them, and their partner. Still with support. It's not like women are just like, no, I want to stand on the street and just like push my baby out in the gutter. It's not like that, is it? Like, of course, as a pregnant woman, you like prepare for things, you educate yourself on things, you have support in different ways, from different people, and they're creating a war on it. And, I really hope that this war doesn't make it. I hope that women still have the legal right to no medical intervention, and to free birth, because that really is like a God-given right, isn't it? And they can argue all they want that, like, oh, there used to be more, um, you know, infant deaths and things like that back in the day when more women were free birthing instead of having, proper medical care and all this sort of stuff. But it's like, yeah, women back then also didn't have like the greatest nutrition or the greatest, other wellness care and things like that available to them, did they? They were doing it tougher in life. And you know, most people would die from like having a cold. Like you can't compare back in the day to now, And yes, tragedies happen all the time, every day, whether a woman is giving birth at home or a woman is giving birth in a hospital. Tragedy can happen. And that's just sort of the roll of the dice of life, isn't it? And yeah, I mean, even now, like, I see ads all the time of like lawyers who are trying to represent women who, have trauma experiences from their births in hospital, so, like it's a whole thing, isn't it? There are women all over the world who could share their absolute traumatic horror stories from birthing in a hospital. So, I mean, that whole thing is crazy to me. But yeah, it's really crazy when you think about the vaccine schedule that they are pushing on mothers to, put their babies through. And I'm not for it. I'm not for it. After my first two, I became against it. And COVID, when they were pushing the COVID vaccines on pregnant women and on newborn babies and all that, no, that was like sort of like the line in the sand for me, where I was like, you people just, you're pushing this stuff not knowing what it's going to do to my kid. And it's just the same to me as like, if someone's spraying like poison, like to kill off insects and bugs and insects and weeds and stuff in a garden, am I going to go walk through that with my baby? No, of course not. Like, why would I just like put my child in a situation where I don't know what's going to happen, but it could very well have a very dangerous, negative impact on my infant's health. Why would I do that? Do you know what I mean? And yeah, I know it's a whole thing, and I know that there's people in the medical field who might say, well, oh, it's to prevent them getting all these different things, and there's no no risk, or the risk is less than the benefit, so that's why we recommend it. But at the end of the day, it should just be a parent's choice. And if a parent makes the choice, if their belief is that they don't want to put their child through that, or themselves through pregnancy, then they shouldn't be treated different. They shouldn't be attacked. They shouldn't be, given the side eye. They shouldn't be spoken about like they're idiots in the media, or by any kind of government officials or health officials. You know, it like, where is your sensitivity on, you know, how you talk about it? It's okay for you to throw all this judgment around and everything, but for somebody who doesn't believe in those vaccines and stuff, for their own, you know, personal reasons, their own religious reasons, you know, information that they have gathered, you know, basically, if you're one of those people, you have to censor yourself, or you can be in trouble for, you know, spreading misinformation, or, you know, for encouraging other people to look into that or think about that. But the officials and the government and the media, they don't have to hold back on their judgment. You know, midwives at hospitals, you know, and healthcare professions, they don't have to hold back on their judgment. And even if they say, oh, no judgment, you know, they still sit there and give you judgment. Like, just saying no judgment doesn't mean you're not passing on judgment. All right, anyway, I'm going to leave the chat here today. I'm talking so much that my coffee's going cold. That's my thoughts. That's my opinions about pregnancies, about free birthing, and about childhood vaccines. I think it's shocking that by the age of, you know, 1.5, 18 months old, 48 vaccines. I counted. 48 vaccines are recommended for your baby, and you have to defend your choice to everyone if you don't go along with their schedule. It's pretty hectic. It's pretty crazy. Yeah, if you've got some thoughts on that, if you've got some stories to share, jump in the chat, jump in the comments, and yeah, do share. I'm interested to hear anyone else's thoughts and opinions, anyone else's experiences. And, you know, in time, you know, we might find out more information. I know they're doing some more investigating in America. And, you know, we'll see what comes of all of that. But otherwise, you know, I think, again, just listen to your own self. You know, everyone has different thoughts and opinions and experiences in life, don't they? So I don't judge you if you want to go get out there and get all the vaccines for yourself and your baby. I'm not judging you. But I also ask not to be judged myself, you know? And that's how life should be, shouldn't it? So, you all have a good Wednesday. I have a school Christmas party to get to today. That'll be fun. Probably have a sausage sizzle or something. And yeah, so you all have a good day, and I'll see you all in a video tomorrow.